sociological feminist philosopher, football fanatic, mom, grandma, retired full professor, author of 7 books. Our speaker today is Dr. Karen Warren, my mother. I moved to Las Vegas in 2006 to join the psychology department at UNLV. And in 2010, when the Ruvo clinic opened, I was thrilled because it was a fantastic platform for clinical collaboration on brain-related issues and mental health-associated factors. And then last year, she was diagnosed with multiple systems atrophy, MSA. And my relationship with the Ruvo Center became far more personal than it ever was professional. Please welcome my mother, Dr. Karen Warren.
I am dying. Unless I get hit by a truck, I know how I'm going to die, and it won't be pretty. On February 22nd, 2016, my life changed forever. I had been experiencing an odd array of symptoms, but none of them made sense. Dangerously low blood pressure, slight tremors, a sleep disorder, RBD, frequent falls, chronic constipation, intense nerve pain. Doctor after doctor, test after test. Nothing made sense until my phone rang. My neurologist said, "I'm sorry I haven't called you. I just didn't know what to say." And I said, "Just tell me the truth. You have multiple system atrophy." He proceeded to tell me what MSA was, but there was too much information for me to digest, so I asked him, "Could I just ask you some yes and no questions?" And he said, "Sure. Is MSA a degenerative neurological disease? Yes. Is it progressive? Yes. Is it fatal? Yes. Does it have a cure? No. Is there any treatment? No. Just medicating for pain." I had never heard of MSA. As I listened and learned, I felt both relief and terror. Relief that I had a diagnosis, but terrified at the reality of this disease. Put bluntly, my nervous system is dying, and there's nothing I or anyone else can do about it. MSA affects such bodily functions as swallowing, digesting, and blood pressure. My blood pressure had been fluctuating for about a year as much as 80 points. Scientifically established by the table tilt test. You all know that. So I knew something was terribly wrong. My symptoms read like chapter titles in an MSA manual. What it took was connecting the dots, and that's what my neurologist did. Learning I had MSA was a blow. I was scared, angry, sad, and I thought, okay, I have this disease, now what do I do? What do people do when they learn they have a terminal illness? This presentation is my self-help guide to what I did after learning I had MSA. It is not given to tell medical professionals what you already know. It's to tell you and others what you may not know. I'm going to talk about MSA from the terminal illness from the perspective of someone who has MSA. Looking back, I see that my process for dealing with my MSA involved answering 8 questions. I began with the question, whom should I tell? I told those first who were emotionally close to my daughter, my extended family, and a few close friends. The hardest call was the first, to my then 38-year-old daughter, Courtney. I told her the little I knew about MSA, and she paused and asked, "Mom, are you afraid of dying?" And I said, "No, I'm afraid of dying this way." Then I told my siblings and dearest friends. They were shocked. They asked, "Are you sure, Karen?" I answered decisively, "Yes. No one, no doctor, no caregiver, no loved one, not even I, can do anything to prevent this illness from progressing. Eventually, I won't be able to walk, talk, swallow, or move. I will go from using a cane to needing a walker to needing a wheelchair, and then I will be bedridden."
That's a lot.
Yes, please.
It's right next to you.
Like me, they had never heard of MSA. And like me, they wanted more information. so we all turned to the internet for that. Next, I told people who needed to know because I would need their services to put my affairs in order. My lawyer, financial advisor, accountant, and various healthcare providers and therapists. For example, I needed help to rethink my finances. Since I no longer needed money until I'm 93, I won't live that long. That's kind of the fun part, I got to spend money. I had to update my will and advanced care directive, since knowing how I will die affects my healthcare needs going forward. What about the people I only know casually? High school friends, neighbors, colleagues. Should I tell them? I wanted them to know, but I didn't want to tell them, so my sister did that. The second question I asked myself was, what do I need? After figuring out whom to tell and saying what I needed to myself, I felt totally overwhelmed. I'm a single mother who has lived alone for almost 25 years. I was comfortable with that until I was diagnosed with MSA. Now the reality of living alone was terrifying because I knew I would need help beyond what provided by physicians and healthcare practitioners. It isn't their fault, it isn't anyone's fault. Many of my physicians are also wonderful researchers. They just don't make house calls. They don't live with their patients when we need constant care, nor do friends. That's just the new reality. Overwhelmed by this new normal, I turned to my primary physician for help. I asked her, who will take care of me? I can't do this alone. And her answer, no, you can't. You need a case manager. By the time I returned home, 10 minutes later, I had a case manager. Pretty fast. My first phone call from my case manager was just what I needed. She said, Karen, I'm looking at your appointments for the next week. You see a physician every day. You have a mammogram and you have an x-ray schedule. Do you like going to all these medical appointments? I said, no, I hate it. Then why are you doing it? I was stunned. I said, I don't know, I guess I didn't have any choice. She said, but you do. You can make choices about what you want as a person living with a terminal illness called MSA. You just need to figure out what you want, what makes your life valuable or meaningful. I was stunned. After I said I don't know, then I had to figure out what was making my life meaningful. That stumped me too. As a philosophy professor, surely I was capable of saying what I value, what gives my life meaning. But in fact, I didn't really know, at least not in the context of dying.
Have some water.
Yeah, just Then she said, this is the case manager, how about this, Karen? You take care of your living and I'll take care of your dying. Whoa, a light bulb moment. Yes, I said, I can do that. It was a relief to know that she would help me with my dying process. She immediately enrolled me in palliative care. My first appointment devoted to helping me die. The next question now you ask yourself, so what do I want? At first I didn't know what I wanted. Most of my life I have done what I needed to do or what I should do. But now the question was about what I wanted to do, and I really didn't have a clue at first. I began by focusing on the people I'm emotionally close to. With them, the answer to the question, what do you want? Was this: I wanted to do with them what they loved doing. For me, this would be a win-win situation. So, during this past year, I have gone to an opera in Central City, Colorado, with one brother-in-law, and I went to the Ryder Cup golf tournament with another. I've been to Florence, Italy, with my brother, sister, and sister-in-law, and I've been to Hawaii with my daughter and grandchildren. I've been to Vikings home football games with friends who love football, and I invited my three siblings to a full day at a spa in Minnesota. We call it the Sims Extravaganza. A day of luxurious pampering with massages, facials, and painting our nails bright red, including my 75-year-old brother. When someone asked a family member, what is Karen doing? He said, well, she seems to be doing whatever's on everybody else's bucket list. I guess I am, but mostly I was just having fun. Other answers didn't come so easily. Excuse me. Listening to others who were dying from a terminal illness, I realized that often what we want, even in our compromised physical state, is to just do ordinary things. Like wash the dishes, clean the house, go for a walk, work in my garden, swim, or exercise. But sometimes these ordinary things are precisely those our medical practitioners and others don't want us to do, lest we fall. And we do fall, sometimes very painfully. The brain centers for balance and coordination continue to exact a price, no matter what I do. And that's just it. There is nothing I or anyone else can do to alter this progression. For me, the physical cost of failing has resulted in injured teeth, 3, a broken toe, a sprained ankle, bleeding, 10 stitches, bruises, a concussion, and lots of tears. These consequences of falling are very real, justified concerns, and I feel the same way. I don't want to fall either. So what should I do? Well, it's complicated. What I want medical practitioners and caregivers and others to do is this. Please understand why we persist in doing these ordinary things, even though we fall. We do them precisely because they are ordinary. We do them because it gives us some control over our own lives. They help us not feel powerless by a fatal illness that leaves us with so little control. For me, the goal in a situation where I have so little control became control the ordinary. Other answers to what do I want required answering a deeper, more philosophical question. This is the 4th on the handout. What really matters to me? After several months of living with MSA, I now know that what gives my life meaning, what really matters to me, are relationships. Relationships with myself, with other people, with animals, with the natural world, even to my own body. Creating or nurturing this relationship is what I value most. But how do I do this? How do I go from honoring and nurturing relationships into real life examples of what I'm going to do? Sounds good in theory, so what am I going to do that does that? Here's what it comes to. When I am no longer able to communicate or have interactive relationships with others, my life will have lost all meaning for me. When I am nearing the end of life, I want to be permitted to die. I now have an advanced healthcare directive that specifically states which medical treatments I want and which I don't when I'm close to dying. Ultimately and unequivocally, I want end-of-life options that permit me to have medical aid in dying. To this end, I have worked with the organization Compassion and Choices. The sole purpose of that organization is to improve care and expand medical aid in dying. Choices for terminally ill people. I'll come back to this at the end with regard to question number 8. So now, question number 5, I have to say, what difference does it make? Or do I have time for this? Actually, this came from you last week, Dylan. I told him that I had a mammogram. I keep telling him like I have a mammogram. And he goes, what difference does it make? I said, exactly. So the question really is, what difference does it make? Do I really have time for this? My time is a little short here. The precious time I have left matters. How do I want to live it? Not die it, but live it. I found myself asking, will doing this or saying that make a positive difference to my health and well-being? Does it make a difference to me whether I participate in a research program, take an X-ray, or have a mammogram? My guiding principle has been this. If doing something makes a positive difference in my life, then do it. If it doesn't, don't do it. Asking these 2 questions helps me decide what really matters to me. Do it if it helps your well-being. Don't do it if it doesn't. My 6th question then, will this action enhance my quality of life? Although there is no cure or treatment for MSA, medical practitioners and others say that we who are living with a terminal illness can and should do things that enhance our quality of life. Well, what does that mean? I mean, I'm a philosopher. I really don't know. I don't really have a definition of quality of life. So it's hard to do it. But I have found some ordinary things I do that are good examples of it. The 2 I'm going to give you is physical therapy and monitoring my blood pressure. Dylan can probably figure out where that's going. Here they are. Soon after I was diagnosed with MSA, I began physical therapy. One day I asked my physical therapist this question: if MSA has no cure, no treatment, what am I doing here? His answer was illuminating. You cannot control or stop the brain from deteriorating. Your balance and coordination will continue no matter what you do. But the physical therapy we are doing will build your core body strength and improve your ability to walk without falling. That's the goal here, Karen, not falling. And now, a year later, he was good for his word. I have fewer falls and I am healthier than I've ever been around brain and coordination. Physical therapy has dramatically improved my quality of life. My second ordinary example is blood pressure monitoring. Even before the official diagnosis of MSA, I needed medication, Midodrine, to raise my extremely low blood pressure, orthostatic hypotension. For more than 1 year, I recorded my blood pressure 4 times a day in 4 positions for a total of 16 blood pressure recordings a day. From lying down to sitting to standing under 2 minutes to standing above 2 minutes. 16 times a day, if the blood pressure cuff worked. It was a slow, burdensome process that I found disruptive of my daily living, of activities that I wanted to do each day. Over time, I learned to take the medication at 4 distinct times. And to supplement this with medication when it was necessary. I learned how to do what my neurologist wanted me to be able to do. I learned to medicate to the symptoms, not to the blood pressure numbers. It's been about 5 months since I took my blood pressure. I haven't taken it because I know now what it feels like to be starting to get low blood pressure. With these 4 regular times a day, I was probably safe, but I now have about 3 in the morning instead of 1. So my quality of life has improved dramatically by not having to take my blood pressure 4 times a day. So my 7th question, what are some practical things a person with a terminal illness like MSA can do to enhance their quality of life? I found that there are many practical things I've been doing that do enhance my day-to-day living. So here are some. Save the cards, letters, emails, and texts that people send you. They are living eulogies. Eulogies you get to read before you die, that you can enjoy and read now and later. Post updates about your health and experiences on a website such as Caring Bridge. Find a support group for you and your caregiver. There really is no substitute for being with others with the same challenges. Write letters to your family and friends that they will have after you die. I am writing electronic love letters to my 2 grandchildren. Every few months I make a video recording of each one for each one. I am very specific. I describe what we've done since the last taping, what I liked about them, what tickled me, and what makes me love them. So I'm due for one after this. Well, since I saw you last, Izzy and Kane, I'm giving a speech at the LouRuvo Center. Write letters to your family. Plan to do something fun or pleasing every day. Do something new each day, even if it challenges your way of thinking that, what will people think? What will people think with Karen with turquoise nails? I don't know and I don't care. And I don't know, turquoise, it matches my outfit. How's that?
That's right. Yeah, really.
Because I really don't care anymore what people think. I didn't make my toes the same color. In fact, this is happening. When I got home, and my granddaughter, Izzy, saw that her mother and grandmother had painted toes, she started to cry. But I don't have painted toes, and I even said I would paint them last night, and I didn't. I'm going to make a mention for that. Schedule activities to look forward to. It really makes a difference to your mood and quality of life. Here's MSA in action.
Yeah.
When bedridden, perhaps unable to communicate, visitors may feel uncomfortable seeing or being with me. They may not know what to say or do. So, my caregivers will post a list outside my door of suggestions of things that you can do while they're with me. Here's some of them. Read me some of those living eulogies. I'm bound to feel better. Tell me a joke, sing a song, play some music, play some of my favorite movies. They'll all be available. Read to me, warm up my hands and feet. Put lotion on my face and arms, massage my hands and feet. Tell me how my favorite sports teams and players are doing. Bring me a caramel pecan roll. If I can't eat it, I'm sure someone will. Bring my cats to me. Show me my gardens. I won't actually be able to see my garden. So this, I realize, can be done with a trick of mirrors. Bring me a flower from the garden. In fact, do whatever you want to do. You're here because you care about me. That's all, always enough. Can't believe I made the last question already. What can I do to foster awareness of MSA and medical aid in dying for adults with a terminal illness? My presentation so far has focused on 7 questions I ask myself. What I need, what I want, what I really want, what matters, and what is quality of life. But I now turn to the 8th question. What can I do to support medical aid in dying options for those of us who want it? As a professor of philosophy for more than 30 years, I understand the academic debate over medical aid in dying. I started teaching it 30 years ago, and it was called euthanasia. But now, this was personal. My academic expertise was now a lived experience. No one, no physician, no family member, not even I, can legally help me end my life. That is because in my home state of Minnesota, and for a bit now in Nevada, it is illegal for anyone to help someone die to stop their prolonged suffering. In Minnesota, medical aid in dying is a punishable crime. According to the philosopher Immanuel Kant, there are 3 properties that make us human: rationality, dignity, and autonomy. Rationality is the ability to entertain abstract principles or to calculate consequences of your action. Dignity is knowing that humans have intrinsic worth. We're not just worthwhile as a means to some end, we are worthwhile as the end itself. There is no substitute value for a human being. That is what it is to have humans have dignity. And autonomy, which literally in Greek means self-legislating. We are capable of making abstract principles which we rationally choose to support and are autonomous by the very fact that we submit to them. Those principles we use to run our lives, and that is what makes us all autonomous. These 3 properties of what makes us human are precisely those that are at risk by depriving people like me of the option to choose medical aid in dying. How does it do that? It does so by overriding, not preserving, the very properties that make us human, our humanness. Physicians vow to do no harm. They think that this means keep people alive at all costs. But this interpretation of do no harm is, in my mind, harmful. Why? Because it deprives people like me, rational, dignified, autonomous adults, who suffer from a painful terminal illness. It deprives us of the opportunity to choose how we will die, even in front of the horrible suffering we will have. Medical aid in dying prevents, not promotes, this harm. The harm committed by not honoring us is to deny our basic humanness. Denying the medical aid in dying option to people like me is not only wrong, it's cruel. I now work to make the Minnesota End of Life Options Act law in Minnesota and elsewhere. I urge Minnesotan lawmakers to go beyond the intellectual defense and listen to us, their constituents, who are facing a certain painful death. I ask them to permit us the peace of mind that comes from knowing that we can decide when enough is enough. In conclusion, there are many challenges of dying with a terminal illness. They're very real. But there are also blessings. I end with very personal remarks about blessings that I have experienced. One blessing is that I have time to prepare for dying. For example, cleaning out my closet, giving away clothes, doing those things I can do. It also permits me to do things I love but may have neglected and renewing old friendships. Another blessing is that I now understand that I am dying and I am living. Dying is a part of living, and living is a part of dying. Every day I remind myself that knowing I am dying offers me the opportunity to be my best self, to spend the time I have left by living fully in the present. I laugh, I cry, I'm silly, and I embrace the ordinary, even if I fall. There will come a time when I won't. I will have enough of falling, but it isn't yet. But the most significant blessing for me was totally unexpected. Sometimes, kind of like now, I'm happier than I have ever been. People say it is because I'm living in the present that I've let go of the past. Well, that certainly is part of it. I have worked hard for decades to successfully overcome very difficult challenges in my life. I did that. But something else is also happening, something I didn't will. When I let go of the past is still there. I can see it, kind of a blur, but I can see it in a long way away. There are things that are still there. What is new is that there is no emotional tug on me from behind, from the past. The happiness and freedom I experience in the present is not something I will. It's not something that I made happen, not something I did. There are no things to let go of. Things in the past, because it's not about things at all. It is about a state of mind. The happiness and freedom that I experience in the present is real. So I did let go of the past, but the past also let go of me. I often see myself in the future, what I will look like and experiences I want but will not have, especially seeing my grandchildren and spending quality time with my daughter. When this happens, I have to resist. I have to say to myself, don't go there, Karen. You will be there soon enough. And when I'm capable of doing that, I am situated in the present, and I am just plain happy to be here. Thank you.
And she would love to talk with any of you if anybody has any questions or discussion or whatever. I don't know how much time, comments or thoughts.
We have half an hour.
We have plenty of time.
I said to Jasmine that if I'm going to give a talk, it needs to be 30 minutes or less, because you need to leave at least 30 minutes for questions and comments. So we did that.
We did. Nice work.
We did that. I think I willed that. I'm not sure. Anyone? Yeah, Andrea.
I can't tell you how much I appreciate knowing you over these years and to see where you are today. Minus the initials attached to you, you are truly the happiest I've seen. And I will tell you that you told me a group of things, having parents that are 92 and 96 years old, that I hadn't put in proper perspective when I've been trying to get them to do certain things. So it was a real gift just hearing you be able to say, you know, think of this, think of this. It was really wonderful. And it's, again, minus the initials, this is the most incredible I've ever seen you.
Ken?
Two things. Is a copy of that available?
Yes.
Okay, that'd be great, because I mean, so those recommendations, I look back at people that I've lost, and I wish that I would have done some more of those. Really, you gave some really practical recommendations about what to do for people, so I appreciate that, and
Thank you.
I'd really like to have that. And the second one is, with those recommendations, what if Courtney had started doing those 5 years ago, before you were sick? My mother doesn't have a terminal illness, but I can see her getting sicker And I think to myself, I'd like to start doing these things, but I don't want her to freak out and be like, are you treating me like I'm dying? Are you having, you know, or are you having, I don't want it to come from a place of pity. So do you have any suggestions about how people can integrate some of these things in their lives for people who are not terminally ill, but are just looking to be supportive of their aging but not dying folks?
I tried to give questions and answers about what you could do that would fit anybody, not just terminally ill. It's just sped up when you're terminally ill. And even terminally ill people won't talk about it with their loved ones or their friends. It's just both too scary and they're in denial about the fact that they're dying. When I first went to my first MSA support group, I didn't go with a caregiver. Everybody else had a caregiver. And the facilitator started with me. She said, well, Karen, welcome to the group. What would you like to talk about? I said, I'd like to talk about death and dying. Silence. I guess we don't talk about death and dying at this clinic of people for terminally ill illnesses. So the next month they said, why don't you start, Karen? What would you like? I'd like to talk about death and dying. Third time, they wanted to talk about death and dying. So it may not work the first time with your mother. All she needs to know is that you love her and you want to do things that are fun with her. Does she have any ideas what those be? You just go through this list and eventually she'll do it with you. I believe that. Does anyone else want to give Ken feedback?
You know, because I do have parents that are 92 and 96, but the list that you gave, they're just things that you would do out of, like, if they, who cares if they're dying? These are just things that make humans feel great, that we don't in our busy lives pause long enough to actually do. So I wouldn't attach it to any end game other than in this moment, I would like to start doing this because I realized I haven't.
That's great. Thank you.
I think we'll publish another blog probably also with all those suggestions. And I'll send that to everybody in here if you'd like.
I'll let Courtney figure out how to get these things to you.
I will figure it out.
That's not on her list anymore.
What is it? Pick up the mantle
Yes.
and start doing it now. Especially what I'm calling these living eulogies. My God, I can't believe how it changed my life. I retired, semi-retired in 2009, officially in 2013. And I had a real identity crisis. I knew who I was as a feminist philosopher. I knew my books, I knew my reputation. So when I lost it, I just felt lost. And what I really felt, it took me a while to admit this, is that I felt unimportant. I felt I didn't matter anymore. And I tried all kinds of ways to make myself matter to others and it didn't work. So one of the women, unbeknownst to me, communicated with the feminist and the philosophical webpage and said I was dying. I got these incredible letters. And at that precise moment, I never again felt that I wasn't important. Those 5 letters freed me up more than anything else I could have done. So why? Because they're living eulogies. You get to hear them. You don't get to hear them if it's your funeral.
Right. I just wanted to bring up something that we spoke about a couple of days ago. And it is very inspirational because living with a sense of purpose shouldn't happen when you have a terminal illness. It should happen always. And living and doing the things that you enjoy should happen all the time. And I remember having this conversation, what is it that gives you purpose? What is it that you like to do? And it needs to be done all the time. So it's inspirational to hear you speak because it's a reminder that we need to pause to do the things we love to do, always. So
Thank you. Ken?
Sometimes I can be impositional with people, and I'm thinking about what you're saying regarding autonomy and dignity, and I invite conversations that people don't want to have. And
You're
so
also a therapist.
Right. And so I'm struggling with, I mean, I can open these doors with my mother, but I wonder what you might have to say about if somebody doesn't want to go there.
They won't go there.
Do you keep opening that door, or do at some point you just take the message and be like, they don't want to go there, and you just stop going there? And so there's a question behind all that, and then the other one is, once the people in your group finally went there, what was the result?
Oh, it was phenomenal. We started sharing in a different way. A guy who had never spoken came on the third meeting, took the card out of his shirt, and it was a medical alert for MSA. He couldn't speak, but the third time he wanted people to know he had this illness. And he pulled out the card. We all wanted the card. And so it started to open up things we could talk about, like getting a medical alert card, which says things like, if I look drunk, I'm not. If I say I need to go to the bathroom, I need to go to the bathroom. Very practical things. That's the first thing I'd say. I always say something about one other person, two other people. There's a man in our group who has PSP, kind of palsy. And he never had spoken. He's in a wheelchair, he's tied in, he sort of looks like a homeless man. He's there with his wife, like this. And every time I would ask him a question, anyone would ask him a question, she'd answer. And she'd always say to me, he can't hear you. So next week I'd ask a question again. I said, totally unplanned. Okay, group on 3. 1, 2, 3. Hi, Jeff! He looked up, he smiled. He just needed us to know he was there. All I had to do was speak more loudly. Next time, the next month he came, he was in a wheelchair. I thought he was lost because his wife was putting him into this lobby where I was. So I went over, I got down on my knees, said, hi, Jeff, do you remember me? And she said, he asked to come in here to talk to you. All we did was yell louder for him to hear it. And the one that's probably the most difficult for me is a woman who's a novelist. She's 63-year-old. She can only move her pupils. She comes to group when she comes with her daughter, who fortunately is an RN, and she just lies there. This is all she does. That's her life. So when we talked to her, we always talked right to the daughter. And I felt the same way. Well, the daughter's going to answer it anyway. Why don't I talk to her, right? So I didn't know she'd be there one visit because her daughter said she had a cold. So I went up to her, again on my knees because she's in a wheelchair. And I said, Pat, I'm so glad to see you. I thought you had a cold. Are you okay? And she went, and Jean said she's trying to tell you she still has a cold. You never know what's going to reach people and what isn't. You just got to put out there who you are. You know, I wouldn't normally scream and Milk Clinic wouldn't ordinarily hook her eyeballs up to a Dynavox machine. Why was that important? She's a novelist. She hadn't finished her novel. So we know she's in there. She's fully rational in there because of this machine. She stopped using it for a while because she couldn't turn the pages with her eyes, and it frustrated her. Just give people who don't have a voice. Whether your mom wants to do what you want to do is really not important. What's important is that you do what you think you can do as a loving son, whether she wants to hear it or not. I'll just have one more anecdote. A couple of years ago, I watched a show. I'm just having an MSA moment, which I haven't a clue what I'm going to say. Oh, I remember. My 9-second rule. My 9-second rule is if you forget something, just wait 9 seconds. Don't stress it out. It'll come to you. I may have to do it again. Just a sec. Yes, it was a show on how to deal with Alzheimer's, people with Alzheimer's. Because they don't remember you, they don't recognize your voice, right? They don't recognize your face. And this one guy did theater with him. It was so incredible. He'd say, hi, how you doing today? I'm okay. This guy comes, he always upset me. The guy's her son. It's him, but he's now acting instead of trying to be serious with me. So he said, well, he must have been a real creep. He was. She was interacting because it wasn't her son. So she felt the freedom to say whatever she wanted. So I told Courtney, if I get like that, just start telling me how lousy you are and how good I am. And we'll make up a little story. We'll just play act it. And it seems to work. I don't know if we can confirm that, but it seems to work when there's no sort of pressure on them to try to be clear, to try to see. Yeah, that guy, he's just always annoying me. It's him, the son. You never know what will stick. Yes, Anne, is it?
Amy.
Amy.
Thank you so much for sharing your story. I'm a little curious about your interest in joining the support group. Was that something that you knew you wanted to do? Were you resistant to it? And what advice would you give to someone else with a terminal illness about what that's done for you and how to get them there.
Have to give me a moment. Nope, gonna need help.
You were reluctant. Were you reluctant to join us?
I was. The reason I wrote this is there isn't anything out there about what to do when you're learning to have a terminal illness. And I realized, well, creating widgets. So I'm just gonna figure out what to do. After I did my healthcare director and got a lawyer, which took me 3 months because it was painful. I even had to be so specific because it's illegal. But I want to make sure they knew. If the only way I can communicate, got this from Pat, is to do this, that's yes, and this is no. And so we've been practicing. Right? And my sister, who lives next door, she was like, Karen, do you have 6 cats? Karen, do you love writing philosophy papers? Do you love the Vikings? It's in there, because I want the people trying to give me healthcare to know I'm in there. This is my communicating, so I put it in my healthcare book. I've got very specific. So after that happened, the first 3 months of redoing my will, redoing my healthcare director, so on, was what now? There is no information about support groups out there for rare diseases such as MSA. There's a little bit more for ALS, but PSP and MSA are fairly rare. They sometimes estimate that only 50,000 people in the United States have been diagnosed with MSA. That's the size of a little town. How can you do research if you haven't got a big research sample, right? So there's an explanation why that is the case. But it leaves people like me high and dry. So I just started to catalog. Well, I went online, went to what's called now the MSA Coalition. I asked them if there are any support groups in Minnesota. They didn't know. I wanted to look it up. One. The people come to my group from Iowa, from Wisconsin, from northern Minnesota, because they want the support. But there was nothing out there that said how to do that. And I wanted this to be 1 year looking back. What did I do? So we don't have to all redo it. We can just add to it.
And what was your reluctance in going originally, and how could you get somebody to go who doesn't want to go to group?
Reluctance to go? Yeah, I got to reaffirm too. The second time I went, death and dying. No. To go to a group, the friction was in the group when I first went. The friction is between those who really believe if they try hard enough they can get a cure, and those, i.e. me, who don't. So the first couple months, this is how the conversation went. Obviously I couldn't participate, because they all go to the Mayo Clinic, that's where they get their doctors. It's 2 hours each way, it's 4 hours once a week, riding to Mayo Clinic. They say, have you tried medical trial that so-and-so's running? Have you looked at the drug MXR3, SU7, whatever it is? No, I haven't. Most of the support group was doing this kind of thing. So once my sister came with me, actually she's come with me almost every time since, and she said to them, how's it working for you? Those medicines working? No. Then why are you doing them? So there was this resistance, but people were there to talk about death and dying, right? So my job became the funny person who said, let's talk about death and dying. So there isn't enough out there. I hope others who hear this speech, you can write about things you've done for your parents or things you've done for a friend who has ALS. Because we need each other to tell us that. Otherwise, the neurologists can't do their job. If they come in and say, do you feel any differences in your skin today? Let me see your blood pressure numbers, which I have to send a week ahead of time. Okay, well, it seems like in the morning at 8 o'clock you're a little low. I suggest you take one or two. That isn't support. That is just, here's what I can do as a physician. And as I said, there's nothing wrong with that. But we have to realize they don't make house calls. They're researchers. Cleveland Clinic, fabulous. One of the few MSA clinics in the entire world. They're researchers. That's not what they're supposed to do. They're supposed to keep me in touch with when I need how many medications. So that wasn't happening because they just wanted to live. And when they started to give that up and would say they gave it up, one woman in particular said, I'm going because I'm convinced there's a cure. And then after my sister asked that question, they started saying there is no cure. And she came to the group when I came the same time she did. She didn't have a cane. Then she had a cane. Now she's in a walker, and she was so beautiful. And she's in a wheelchair. And the time I was there. Now, I don't know if that means anything, but I do know you got to do it now. If you're going to do something that makes your life happier, do it now. Because you don't know. I don't know how long it'll be before I have to go to a walker, probably in very little time, because everybody I know wants me to have a walker, right? Because I won't fall so much. And we hear you, but I'd rather have the sense of control and willingness to fall. I'll take that It's my decision. If I don't stop falling, that's my fault. That's on me. I know I should probably have a walker in every room, so there's no time I'm not using it. But it's my choice not to. And accepting fully the consequences are on me. So that's what I think needed to happen in that group. They needed to take seriously the consequences are on you. It's your life, you're dying, you know what that feels like, you hear what's said in here, what are you going to do about it? And because I'm sort of outrageous with these like 1, 2, 3 on 3 groups, they sort of put up with it. And then now when I started to write a little bit about it, they crave it. That wasn't there a year ago when I started. And they start to do things that are funny. You know, like Pat, right? The noise going, she's trying to tell you she still has a cold. Wow, you still have a cold, Pat. You know? She couldn't smile, she couldn't nod her head. And I realized my mission in life was decided when I learned I have MSA. I finally could answer the question, what's my purpose in life? All the time I've lived with myself, I had no clue. But I knew my purpose was to give a voice and a choice to the terminally ill, as long as I can. That's my job. That's why I'm here. Yes, we went to.
You know, I thought it was interesting that you said that you were doing things that your loved ones wanted to do. And because my husband has ALS and he's dying, and so we both retired while he can still move. And I keep saying, what do you want to do? What do you want to do? Let's go do what you want to do. But, you know, dude, sweet, man. I don't know, I don't know how long it's going to be easy enough to do it. And he's just keeps saying, whatever you want to do. And I am having such a hard time with that because it's like, no, it's not, I'll have time, maybe, unless I get hit by a bus. I'll have time to do whatever I want to do. We got to do what you want to do. Like what? And he goes, I don't.
Maybe what's the ordinary, like what she was saying.
I don't know. It is. And my daughter, I had to work hard
So
to decide whether I kept that in my speech, because she said, Mom, it sounds codependent. I said, I don't need to care for this. It's true. Try to figure, because I never give myself this, what do I want to do with my life? Oh, I like being with my family. I like being with my daughter, my grandkids. What do I want to do with my life? You know what? I will be happier if you tell me what you love, like the opera. And I happen to know my brother-in-law was taken there since he was 5 years old by his father. 25 years he's been going to the opera in this sheriff's town in the mountains of Boulder. I wanted to do that with him. We had like a relationship we've never had because I did that with him. He related to me out of the place of what he loved, not trying to fit into what I like, and it made me happy. So then I took my brother-in-law's, in fact, the first thing I did when I learned I had this illness was I bought Ryder Cup tickets. There were 700 each. And I wrote a text, I think, or called my sister and said, you're the first one I'm doing this with. Tom loves golf. He loves it. He lives for golf. I said, I'm going to buy these Ryder Cup tickets. And Tom, who didn't yet know I had this illness, said to his wife, does Carrie know it's $700 a piece? And that's when she realized her husband didn't know. He said, no, I got to talk to you. We had a blast because we were doing what he wanted to do, and I was doing it with him. Yes, Wayne?
What do you think would have been the ideal way for your doctor to deliver the news to you? And was that it?
Oh, that's a big
No,
story.
that's not it.
No.
My doctor and I get along really well in a sense. He's kind of a jock in medicine, and I'm kind of like to know the facts, but what can I do now? And he's not that kind of a neurologist. In fact, we disagree about almost anything. I want medical aid in dying, he doesn't. I now want medical cannabis, he's opposed to it. He's got the clear Western medical solution to what I should be doing. But there's this little part of him that's kind of mesmerized or curious about who I am. So when I first did this post with Courtney on her column, The Naked Truth, I asked him to read it. He didn't say anything, that's also true of him. I said, did you read the post? Uh-huh. What did you think about it? I was impressed, frankly. But I had to push it out of him, you know? Yeah. Because I needed him to know who I was. I needed him to know, I know I'm falling. You want to give me another medication, another medication? I don't want any more medications. I don't want more constipation. I don't want more upset stomachs. I don't want any of it. So I'll tell you what. You give me what I need to have medically to the point that I no longer take my blood pressure. That's kind of a sin for a neurologist. with a disease that is about your blood pressure, right? But it's kind of become funny now. And so we've found a way to relate. He hasn't changed his views, and I'm happy with him. That's what makes him a good neurologist, right? He knows what I need to do. And I tell him I'm doing it, just not quite how I used to. So I think there can be this harmonious, honest relationship with your doctor. And enjoy some spoofing, some laughing. I said, well, I've got approved for medical cannabis. I'm the first person in Minnesota in Health Partners to be approved for medical cannabis. What do you think? I'm opposed to it. Why are you opposed to it? Well, because it'll open the doors to others wanting to have it. I said, gotta be real here. Open the doors to what? More THC? I mean, what's the problem? I'm gonna get high on this? What difference does it make to me? I would love to get high on it. I would love it. Hasn't happened yet. Well, it has happened, but I can't do that and walk at the same time.
But the way that he first told you, you were very mad.
I was furious because
so you should share that, how that happened.
I have a rare sleep disorder, which unbelievably is in the MSA manual on what is MSA. It has 12 chapters. 2 chapters are on RBD, REM sleep behavior disorder. No one's ever heard of RBD, but I have. When I saw that in the book, God, RBD even counts? Chronic constipation even counts? I meant it, but I said it's like titles of a manual. The guy who prescribes the RBD is my sleep doctor, but he's also my psychiatrist. He's both. And for years, maybe 45 years, he's published on RBD. He's the one who called my neurologist and said, you have to tell him. Because I happened to go to see him. I said, did you get the results of my DAT scan? You know what that is? He said, no. I said, that's odd, because I signed the release form 3 weeks ago. I didn't get it. Then he called me as soon as I got home, and he said, I hadn't gone to my box yet. I just came off vacation. Yes, it's in. Can you tell me what's in it? Yes, you know you have a rare kind of Parkinson's that is MSA, da-da-da. And then he contacted my doctor. And my doctor twice, that's not just the one I said, but before that said to me, I just didn't know what to tell you. And I have to just keep saying to him, tell me the truth. You think I can't handle it? Heck, I got a terminal illness. I can certainly handle the truth. So I was angry with him. In fact, that day I had oral surgery. So I'm trying to drive like this, you know, with my mouth in pain. I'm not sure what I wanted to say. I get a phone call from him because he hadn't told me yet.
He was delaying. He was intentionally avoiding telling her for many weeks because he said he didn't know what to say.
The test was on January 22nd. On February 22nd, he hadn't yet told me. That's a month. And when he did, it was exactly what he said. He didn't want to tell me because he didn't know how. And after I heard that and went to an appointment with him, he just said, I'm a little odd on this right now because I went to the other building, but we don't go to the other building until next Monday, and it's Friday, so I didn't even know where my office was. So he was an hour late. He comes in, I said, kind of funny, where you been? He said, well, I've been walking real slowly over here from the other building because I've got something I want to tell you, but I don't know how. And I said, just tell me the truth. He didn't want to tell me the truth. He was afraid I'd fall apart, whatever his reasons are. And I said, you gotta know me by now. Telling me anything else like that is gonna smell rotten to me. So his reluctance is part of the problem for me. The medical cannabis is part of the problem. He didn't like my not taking my blood pressure, but my cardiologist said your heart is 100% healthy. Do whatever you want with your blood pressure.
What would have been ideal for him to just simply to sort of give you all the information he had once it was collected, give you the information serially over time, and give you an idea of where he was thinking? What's sort of the best way to go about it? Because I often struggle. Our appointments here are months apart. So I might see a patient, and the next time I will see them is 2 or 3 months away.
Same with me.
And in the meantime, I'm collecting some testing, and I may have a diagnosis, but my preference is generally to discuss it with people face to face. Although I imagine there may be some people who would want to know as soon as I know. I guess it depends on the person, or do you have a...
I didn't think he had that insight to know you have to do it differently with different patients. You know your patients. Can she handle it now? You need to do it on the phone, you need it in person. I was furious. He didn't do it in person. He didn't do it a month ago. I was furious with him. When he said, I didn't know what to tell you, I thought, is that why I had my psychiatrist, sleep doctor tell me? He's not the neurologist. And he referred me to the neurologist. He said, you got to make an immediate appointment with the neurologist. He could tell me.
If he had a different explanation and he had a rationale, would it have made a difference for you?
No. As you can probably tell, I'm pretty forceful about what I believe in. So it's like, for me, the truth does set you free. Always has for me. It's how I spent 50 years undoing demons in my life. I just needed to know the truth. And once I got it, I was okay. I couldn't do it.
I do want to mention one thing to you, Dr. Wynn. So a friend of mine is been going through testing for Alzheimer's disease. And I believe the results came in before she had left on her trip to Australia. And we could have pushed her into the door to get the diagnosis, but she had told Dr. Wynn ahead of time that she'd get the diagnosis when she returned.
Perfect.
And her daughter wanted her to have the information before because she really wanted to be able to talk her out of it. But so when we checked to see if we could get the earlier appointment, Dr. Witt, you honored her very much when you said, no, she wants to hear the news when she gets back.
Yes.
Good for you.
So thank you for
Good
that.
for you. That's knowing you're patient.
Yeah. So you did it right.
Oh,
You're doing it right.
well, once.
That's one. Yeah, here's one other thing my neurologist said to me when I wanted the medical cannabis, and then when I wanted medical aid dying, that was about his limit. Here's what he said. She's small. Karen, in my experience, people with MSA love having their family and friends with them when they die. And I said, start right there. I will get no pleasure out of watching my family, having my family sit next to me and know exactly what I want, medical aid and dying. They can't give it to me. They'll come in day after day, I still look the same, and they can't give it. What is agony that is for my family and friends? The compassion should be for them. Right? And if you don't have medical aid and dying, they all have to sit there maybe 2-3 years while I'm in bed, and they can do nothing about it. So I said to him, this isn't me, you ought to know that by now. There's no compassion in me if I actually just wanted to skip that stage. When you know I don't, help me. Don't just prescribe meds for me, help me figure out how to do this. He didn't know if there was any support group in Minnesota. I had to get through the MSA coalition in the East. When I told him what 5 was, he said, I'm surprised you have that many. He wasn't listening. Now I'm still with him, because he's really a great neurologist. He's just a little short on the PR skills.
So but you got the things that he just isn't constitutionally able to provide. You were able to find those.
It must be because he's still with me, and he gives me very much attention. I was his first patient or second patient. He worked at the Cleveland Clinic here, and he transferred to the clinic in University of Minnesota to the neurology specialty. Moved to his clinic.
Maybe we fired him.
No, they worked together. The neat thing is, I complained about one physician because he was inappropriately physically. So I called the secretary, I can't go back to this guy. Anybody else? I said, well, we've got this guy coming on from the Cleveland Clinic. He's been here only 2 days. You'd be his first patient. I said, great. A Friday, he gave me 3 hours. He didn't have any other patients. I loved it. I got special treatment. But he still tends to give me that. And I said, do you like this? He doesn't say yes. He said, why would I be spending all this time with you if I didn't like it? I said, is that a yes? No. But you sound like a really compassionate person.
Well, and you're very honest.
And you're very honest.
You have challenging conversations, and not all physicians do. That's my experience of you, anyway. And your wife. Well, you have a psychiatrist as a wife. What are you going to do?
I also hear you
She's a
saying,
lie detector.
I also hear you saying that you don't want your physicians imposing what they would do in the situation or their preferences onto you, while at the same time saying it's an individualized decision. And what if a physician perceives that the person doesn't want to be told and that they actually do want to be lied to for a
Fine,
period of
it's
time?
not me, you know.
Right? But it's just...
Well,
shared.
but I will tell you
You
that
shared.
just hearing this just now, it so struck me, like, what do you mean they wouldn't tell you? But then hearing the doctor, I think at the beginning of a process, I would now know to ask. Say, I know we're going to be going through this process. As you know something, I want to know it. And in the turn, I would say to an MD that maybe there should be a protocol where, you know, we're going to be doing a lot of testing. At what point would you like me to wait or would, you know, what process do you want me to use? It seems like a real courtesy.
Yes.
Because
Yeah.
someone could say, oh no, I'm going to Italy, I'll get back. You know, like, I think just having that question in the conversation would be very helpful, because it was shocking to me. I remembered the person had avoided you. It didn't dawn on me they were really avoiding you. Like,
Avoiding.
I think that's crazy that a
the
doctor
answer.
would have had information
Absolutely.
and not called me.
Yeah.
Or not showing up at the doctor's appointment.
Yeah.
Yes.
Like just,
That's he hopes
That's kind of loopy, like, that's
Yeah.
outside, and yet I know that I've talked to my parents, and I have had very, very clear conversations from the point at which they turn 90. No cutting, no chemo. We don't, you know, live your life as best as possible. Those things aren't gonna make your life better, so they manage their care that way. So I don't know if they have anything. I just know they're living their life really well, and they know that we'll do whatever they want in a heartbeat.
Yeah.
But
I was just saying, one reason I stuck with
So,
the
excuse
We're
me,
gonna
I
have
have
to
to
get
cut you
out.
off, but
okay.
we're gonna have to take the rest of the questions offline. We're
Okay,
about to
okay.
get started for we actually have another program starting
Oh,
at
okay.
14.
Thank you.
thank you, everybody.